The Erie County Health Department received 2,000 pediatric doses of the COVID-19 vaccine today. It's hosting a special vaccination clinic this Saturday that is exclusively for children between the ages of 5 and 11. It will be held at Oshai Children's Hospital in Buffalo. You can call 716-858-2929 to register. Other pediatric vaccine clinics will be held in local schools in the upcoming weeks.
So now that kids between the ages of 5 and 11 can get the pediatric dose of the COVID-19 vaccine, where can you go to get one and what are the benefits? Here's 7 Eyewitness News reporter Natalie Fahmy.
As a parent and pediatrician, we've been waiting for this for months.
Children ages 5 through 11 can start getting their COVID-19 vaccine today. Both Dr. Lauren Kuwick and Dr. Raul Vasquez say they have 300 doses to give their patients.
This adds real protection to them, which they didn't really have before this.
We're asking all parents to vaccinate their children now if they're over the age of 5.
And this added protection should keep kids in school. Currently in New York State, if there's a COVID-19 infection in a classroom, a fully vaccinated student would not have to quarantine.
Which is gigantic. I talked to so many quarantined families, and that's really difficult.
If parents would get their children vaccinated, we'd be in a much quicker position of actually getting those restrictions out of place.
But many parents are still on the fence about getting their children vaccinated. A survey done by KFF Vaccine Monitor in October shows just under 30% of parents are eager to get their kids the shot.
Although the risk is low for hospitalization, it can still happen, and this is a vaccine-preventable illness.
According to the CDC, more than 8,000 children have been hospitalized with COVID-19 due to serious illness, and more than 5,000 have developed a multi-system inflammatory syndrome linked to COVID-19, leading to ICU admission.
This is a highly contagious illness. It really is in the best interest of your child for them to not get this.
No mandate can be put in place until the vaccine is fully approved. Dr. Vasquez says in the meantime, masks are still a good idea.
Maybe March, April. Then we start looking at this a little bit different.
And if you're planning on taking a trip for Thanksgiving, don't get your child their first dose this week, as they'll need to be back 3 weeks later for that second dose. CVS is also offering the vaccine for children aged 5 through 11. You can find a location and make an appointment on their website. In Buffalo, Natalie Fahmy, 7 Eyewitness News.
Now, the needle for the pediatric dose of the Pfizer COVID-19 vaccine is smaller than the one used for adults. And just a reminder, the dosage for kids ages 5 through 11 is the same vaccine as adults receive, but smaller. 2 doses, 21 days apart. Each dose is a third of the size used for people ages 12 and older. As the Pfizer vaccine rolls out for children ages 5 to 11, some parents may be curious about potential side effects. Data from the clinical trial shows that the most common side effect is a sore arm at the injection site. There were very few cases of fever and chills amongst children. The CDC reports some other side effects may include feeling tired, as well as headaches and nausea. Experts emphasize that the vaccine is safe and effective.